This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
My name is Gabo Martinez. I'm a PGY3 currently at Mayo Clinic, and I'm from Puerto Rico. I did my undergrad in Utah at BYU and med school in Virginia, and now here for residency.
And Gabo, so it's not letting me share mine.
Okay, I'll try to.
Sorry about that.
Yeah, no worries.
So we had some technical difficulties with our work computers not letting us access an outside Zoom link. So I am on my iPad and am not able to share my screen. But I can see your screen.
Okay, cool.
Yeah. So I'm Kaylee Dean, originally from Washington State, moved here to Minnesota for intern year, and then stayed for PM&R residency, currently a PGY3 with Gabo.
I didn't mention it, but I did my intern year at IU in Indianapolis. So we'll kind of split up the presentation. Kaylee will do the first part, and then I'll do the second part. Feel free to type in any questions you might have. And then we have our contact information at the end of the presentation. Feel free to contact us if you have further questions that we don't get to tonight.
All right. So just to kind of kick things off, why Mayo? So, working here, we feel pretty blessed. We've got pretty close access to world-class colleagues. We just recently were ranked the #1 hospital in the world by the US News and World Report, I believe for the 7th year in a row. And we have essentially a way to reach out to any of these specialists via an on-call system. So really at any time of day, you can page, the world's expert in whatever it is question you have, and can get a hold of somebody, which is really kind of a cool thing. Education is prioritized here. So feedback from all of our attending physicians, which we call consultants, is expected. We have mentorship available within the program. Pretty much from kind of right when you start, you are assigned a mentor in the class above you. There's also mentorship that occurs between the 2nd years and the 4th years who serve as seniors on the unit. And then you're also assigned an advisor who is one of the attendings on staff to kind of meet with you on a semi-annual basis to go over things. And then besides those formal mentorship opportunities, there's also informal mentoring that occurs as well. And one of the main mottos at Mayo is the needs of the patient come first. And I really do think this is true. You'll see attendings, nurses, other administrative staff just bending over backwards to try to make sure that, patients are taken care of. Even as PGY2 residents, there's a lot of responsibility and accountability that you get right off the bat. So on the inpatient rehab unit, you're assigned to these patients and they look to you as their physician. You do have a lot of support coming from your senior residents and attending physicians, but you are their main doctor that they're assigned to, which is great. A lot of access to research opportunities, people are always willing to either, have you come aboard a project that they're working on, or, potentially suggest someone else who might be working on something that's better aligned with your interests. And then work-life balance is really great. So we all have, time to do things outside of work that we also love. A lot of people have families, lots of hobbies and different activities that people enjoy doing. And we definitely have time for that. So these are a couple pictures. On the top left and the top right is our downtown campus. And so this is where most of the outpatient clinics are, as well as Methodist Hospital, which is a hospital targeted mostly for OBGYN and cancer care. At the downtown campus, we see more than 1.4 million patients per year. Patients come from all 50 states and 140 countries around the world. And then there in the bottom left is St. Mary's Hospital. So this is a level 1 trauma center. And right back behind the hospital there, which you can't see in this picture, is the inpatient rehab unit. So it's a 36-bed unit. It's connected to the main hospital via an above ground skyway, as well as an underground walkway, which both of those come in handy in the winter. Here's a couple other pictures. So Rochester itself is has 121,000 people, about 226,000 if you include the surrounding suburbs. And the downtown area is kind of situated right on the river there, as you can see. So our PM&R residency, there are 8 residents per year. 2 of them are categorical. So essentially match into Mayo for intern year, and then as a part of the internal medicine program, and then stay on for PM&R residency. And then the other 6 spots are people who do their intern years elsewhere and then come and join us for PGY 2 year. So I did my intern year at Mayo, and then Gabo, like you mentioned earlier, did his in Indiana. After residency, so we have a lot of different fellowship opportunities here at Mayo. There's a pediatric rehab fellowship, sports medicine here in the Rochester campus, as well as sports medicine Mayo Clinic Square, which is up in Minneapolis, which is a little over an hour away from here. There is through the anesthesia department, there's a pain medicine fellowship. And then also we have a brain injury fellowship. So Mayo has a lot of different campuses. So we have our campus here in Rochester, but we also have campuses in Jacksonville, Florida, Scottsdale, Arizona, Minneapolis, like I mentioned, and then a lot of community-based facilities throughout the Midwest. One of the things that's pretty cool is that we have the opportunity to do away rotations. So we can do a maximum of 3 4-week blocks away at these different sites. And so a lot of residents do take advantage of that. You have, and then we also have over 40 different consultants or attendings in the department as well. And I did mention the 4-week blocks, but so essentially the year is broken into 13 of these 4-week blocks. And so you can see the schedule is laid out here. As a PGY2, you do 6.5 blocks of inpatient, which is split between our inpatient spinal cord injury team, which sees spinal cord injury as well as medically complex patients. That's usually where our amputee rehab patients go as well. And then the other team we have inpatient is the brain injury team. So stroke rehab, traumatic brain injury rehab. 5 of those blocks are outpatient. Another block is inpatient consults. And then we do have 2 weeks of research as a PGY2. PGY 3 year, you will do 6 blocks of EMG. and then 5.5 blocks of outpatient and 1.5 blocks of inpatient peds. And then as a PGY4, you'll come back to the inpatient rehab unit and do 6 blocks as a senior. And I think that this is a pretty cool thing that we do here. So when you're a PGY2, you are the junior on the team, you are responsible for carrying the patients. But then when you come back as a senior, you're more in a role where you're overseeing things and almost acting as a kind of a junior attending, preparing for, when you go out into practice after residency. So I think it's nice that we get the opportunity to go back to the unit. And then there are 6.5 blocks of outpatient and electives, and then another 2 weeks of research. During PGY3 and PGY4 year, we do have continuity clinic. And so that is when you're on your outpatient rotations, you will have 1 half day per week that's assigned to your continuity clinic. And one of those particular half days is actually blocked off for research time. So really in a 4-week block, you'll have 3 continuity clinic days and 1 half day of research. And then I'm not going to read through all of this, but this is just kind of a breakdown of the different rotations that are available and as part of our core requirements. So, the inpatient, I forgot to mention the cancer. I will just highlight on that. So as I mentioned, the Methodist Hospital, which is at our downtown campus, does a lot of cancer care. And so we do have a large percentage or a large population of patients that come through that we evaluate for and make recommendations for rehab. Then down at the bottom also is the Mayo Clinic Square or Florida or Arizona. Just I'll highlight those again as potential away rotations that can be done. Mayo they have housing that they will arrange for you. They'll also arrange transportation for you to get down there. And I believe they will also help with getting, if you have family traveling down with you, they will ship boxes of things, which is kind of a cool perk. And then the call. So as we do all of our call is home call. As a PGY2, you will do about 13 weekends and no weekdays. And so essentially when you are rotating on the inpatient rehab unit, every other weekend while on inpatient, you will be on call. And you'll be on call for, you'll see patients from your team, which if you're on brain or if you're on spine, you'll see those patients on Saturday and Sunday morning. You'll split the call in the evenings on, Friday, Saturday, and Sunday night with the other junior resident who's on call with you. So you won't necessarily be the only one on call from Friday night till Monday morning. You split that with someone. And then as a PGY3, you will have about 3 to 4 consult call weekends. And then when you're on your inpatient peds rotation, you will take evening call on a weekday, typically about once per week. And then as a PGY4, you'll have 2 to 3 consult call weekends and about 20 weekday call nights, which is essentially when you're a senior on the unit, about 1 night per week, you're doing the weekday call. And then as far as the didactics and different learning opportunities, we have a lot of different things going on, multiple conferences that you have the opportunity to attend every single day, grand rounds, sports medicine, pain medicine, brain discussion groups that all are occurring weekly, monthly journal club, lots of opportunities for sports coverage. And these are just kind of some of the highlights. You can feel free to reach out if you have specific questions about these. And then as far as the courses, so during PGY2 year, you will go through a research course and then also an anatomy course, which is targeted more at, what is pertinent for us as physiatrists. And so that is a pretty cool hands-on course that we go through. We do our own dissections and we do the teaching to our colleagues. We also have a pretty robust musculoskeletal course as a part of our didactics in the fall, where we're doing physical exam, ultrasound, also practicing some peripheral joint injections in the cadaver lab. And then also we will do spine injections in the cadaver lab as well. And then PGY 4 year, we have the opportunity in the spring to do an advanced diagnostic ultrasound course, which most of the residents take advantage of. And then new this year is a lifestyle medicine track, as well as a clinical educator track. So those are a couple of things we're all pretty excited about.
5-minute warning.
All right, so I'll take over here and try to wrap up here. Let me go back. All right, so we do quite a bit of procedures, starting with PGY2, you do quite a bit. Here's just a comparison of the average, national average for the 2021 graduating class and compared to ours here. Because we do 6 months of EMG, you get easily over the requirement, and if that's what you're interested, you get even more. One of our current PGY4s, he's going into EMG fellowship and he's done over 400 already. Do quite a bit of peripheral joint ultrasound guided injections, as well as spine injections. And the numbers here for the Botox were a little lower for the 2021 graduating class, and that's a focus that they've changed. Starting with our year, just last year, I've probably done over 20-25 Botox injections. So we got a pretty good head start there. We do quite a bit of research, and Mayo is pretty generous with their funds for attending conferences. So we get one attendance for our residency, one attendance trip, and you don't have to present anything. You can just, Mayo will pay for it just for you to go. So that'll happen once during your residency. And once per year, you could have a local attendance trip. So that would be kind of Wisconsin, Iowa area, or now with COVID, if it's a virtual, they'll cover the cost for just an attendance, one per year. And then if you do have a presentation, a case report, or if you're part of a committee, then Mayo will pay for you to go to the trip. So we get 10 weekdays to go to different conferences. So that would probably equal 3-4 conferences per year, if you're presenting or on a committee, or if you include that attendance trip. And they'll cover $1,750 for travel and food, things like that. And then the registration fee is separate. And there's plenty of support from librarians, statisticians, some media support they'll help you make your poster. And like Kaylee mentioned, there's plenty of research mentorship here. So after residency, many of our residents do go on to fellowship, but not all of them. Here's just a chart with some of the recent grads. Particularly if we go to this most recent graduating class, 7 of them went on to fellowship. 3 of them did sports medicine. 4 of them did pain. And then 1 went into private practice here in northern Minnesota, and he's doing a kind of a hybrid of inpatient and outpatient. So many perks with being here at Mayo. We have a subsidized employee-only gym, which pretty much the more you go, the cheaper it is. We do have a social and a wellness committee, and these are kind of starting to ramp up again. Things were a little quieter during the early parts of COVID, and now we're becoming a little bit more active with the activities we're organizing. The Mayo Fellows Association, it's for the whole institution. Plenty of other things to help support you. Many moonlighting opportunities, those are really good. And then they do have a program to help your significant other find a job if you're moving here. And Rochester itself, pretty low cost of living and no traffic pretty much. So here's just a quick snippet of this year's stipend, which is pretty generous and considered to the low cost of living here, really can stretch quite a bit. So there's plenty to do out here in Minnesota. Of course, we have cold winters, but summers are very, very nice. You do get all 4 seasons, and of course, it's the tons of lakes around here, particularly up north. We do get together quite a bit. We do enjoy doing intramural sports. That's our volleyball team. We won the championship 2 years in a row. Go out boating on the lake. Recently, we went out to the Honkers baseball game as a program, and lots of getting together as well. So here's our contact info. Feel free to take a picture of that and reach out to us if you have any questions. We might have a minute or two here. We can answer a question or two in the chat here. So there's a question about the ultrasound guided carpal tunnel release. We do that. We do have a rotation with the hand clinic, and you get a chance to see that. You don't. I don't think, at least in my experience, I actually just finished the hand rotation. I don't think we get a chance to do it. At least I didn't. But certainly, if you're exposed to it more, they might let you do it. Kaylee, do you want to jump in with one of these questions?
Yeah, so Alexa, it looks like you have a question about the culture of education. I mean, I would say that.
Oh, sorry. I saw
Sorry.
Alexa mention me, so I just wanted to hop in.
Yeah.
Sorry, I'm a little late here. So I'm Robert Pagan Rosado. I'm one of the chief residents at Mayo. I don't know if anyone can see me here. Let me just turn on my camera quickly. Here you go. Yeah, so I think the culture here is, I think, and Kaylee and Gabo can maybe co-sign on this too. I think it's very, very unique. I think for being such a well-known name and such a great institution and big and well-known and around the world, I think people are so humble and also like just down to earth. I think people here, everyone has a very open door policy. People are just very easy to reach through email. They give us their phone numbers when we're on call. They come when we're on call and they drop cookies, donuts. They reach out when we had people that had COVID. They would drive to their homes and bring food and make groceries and things. Consultants driving to your house, which is pretty special. And something I really appreciated when I rotated as a student there. So those are just my thoughts. Maybe Kaylee has something else to say. Sorry for jumping in there.
No, that was perfect. That highlighted everything I was going to say. And I worked on the unit on Thanksgiving last year, and one of our consultants actually came walking in early in the morning, right around the time us residents were getting there, with a container of freshly baked muffins that his wife had baked, and he walked them over to the hospital just to drop them off for us. And then he left, to be home with his family. But it's just little things like that people are doing. They all really care.
Sorry. I was just going to step in. We're a little bit over time. I just wanted to give you guys the opportunity to answer like one more question, and then we'll have the University of Cincinnati hop on. We have been having applicants throw questions into the chat. And so if you guys are willing to stick around, you can answer them through there.
Perfect. That sounds good. Do you want me to answer just this last one?
That's fine.
Okay. So the question, how frequently do advanced residents match to a prelim year in Rochester? I mean, there's 2 prelim spots per year. I'm not sure, I guess maybe I can chat with you, Gary, offline about specifically if you have more questions related to that.
I think the question is, if you don't get the categorical spot, if you will get a prelim spot as being an advanced. And I don't think it's super common to get a prelim spot if you don't match categorical.
Yeah, I think maybe that there was a change in the last year or two with them opening up some potential spots, but I think that that might be new. It wasn't available when we were matching. That wasn't an option.
All right,
Yeah, thanks to you guys. Like I said, if there's any other questions for Mayo, go ahead and throw them in the chat.